Dexamethasone, also known as Hidex 1.5 mg, 21 tablets in a dose pack. Glucocorticosteroids, is used to treat a variety of conditions, including arthritis, blood/hormone disorders, allergic reactions, skin diseases, eye problems, breathing problems, bowel disorders, cancer, and immune system disorders. It is also used as a test for an adrenal gland disorder called Cushing syndrome. Dexamethasone belongs to a class of drugs known as corticosteroids. It works by decreasing your immune system's response to various diseases, which helps reduce symptoms such as swelling and allergic-type reactions. When taking Hidex 1.5 mg, 21 tablets, it's important to follow the dosage instructions provided by your healthcare provider. Typically, the recommended dosage will depend on the specific condition being treated and individual factors. It is best to take this medication at the same time each day to maintain consistent levels in your body. If you have any concerns about the appropriate usage of Hidex 1.5 mg, 21 tablets, consult your healthcare provider for personalized advice. When taking Hidex 1.5 mg, 21 tablets in a dose pack. Glucocorticosteroids, it's important to follow your doctor's instructions. You should take this medication with food or milk to prevent stomach upset. If you're taking the tablet form, be sure to take it with a full glass of water. If you're using the liquid form, use a special measuring device to ensure the correct dose. If you take this medication once daily, it's best to take it in the morning before 9 a.m. If you're on a different schedule, it may be helpful to mark your calendar with a reminder. The dosage and length of treatment will be determined by your doctor based on your medical condition and response to treatment. It's important to take this medication exactly as prescribed and to follow the dosing schedule carefully. Your doctor may gradually reduce your dose from time to minimize side effects. It's crucial not to stop taking this medication without consulting your doctor, as some conditions may worsen when the drug is suddenly stopped. If you experience symptoms such as nausea, dizziness, weakness, or muscle/joint pain, it's important to consult your doctor or pharmacist for more details. Be sure to report any new or worsening symptoms to your doctor as well. Some common side effects of Hidex 1.5 mg tablets include stomach upset, heartburn, headache, trouble sleeping, or increased appetite. If any of these effects persist or worsen, it is important to consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, it is crucial to inform your doctor immediately if you experience any serious side effects such as signs of infection, bone or joint pain, changes in heartbeat, eye pain or vision changes, unusual weight gain, swelling in the face or extremities, symptoms of stomach or intestinal bleeding, changes in mood or mental state, muscle pain or weakness, easy bruising or bleeding, slow wound healing, or seizures. This medication may also rarely cause an increase in blood sugar levels, potentially leading to or worsening diabetes. If you experience symptoms of high blood sugar, such as increased thirst or urination, it is important to notify your doctor. If you already have diabetes, it is essential to monitor your blood sugar levels regularly and share the results with your doctor, as adjustments to your diabetes medication, exercise regimen, or diet may be necessary. In rare cases, a serious allergic reaction to this drug may occur. Seek immediate medical attention if you experience symptoms such as a rash, swelling or itching, severe dizziness, or difficulty breathing. It's important to note that this is not an exhaustive list of possible side effects. If you experience any effects not listed here, it is important to speak with your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects, and report any side effects to the relevant authority in your country. Before taking Hidex 1.5 mg, 21 tablets in a dose pack. Glucocorticosteroids, make sure to inform your doctor if you have any allergies or if you are allergic to any of the ingredients in this medication. It's important to discuss your medical history with your doctor, especially if you have any infections, kidney or liver disease, mental/mood disorders, high blood pressure, heart problems, diabetes, or any other health conditions. Using this medication for a long time can make it harder for your body to respond to physical stress, so it's important to inform your doctor if you are going to have surgery or emergency treatment. This medication may also mask signs of infection, making you more susceptible to getting infections or making existing infections worse. It's important to avoid contact with anyone who has a contagious infection and to consult your doctor if you have been exposed to an infection. This medication may cause stomach bleeding, so it's important to limit alcoholic beverages while taking it. It's also important to inform your healthcare professional if you are using this medication before having any immunizations or vaccinations, and to avoid contact with people who have recently received live vaccines. It's important to note that older adults may be more sensitive to the side effects of this medication, and it may slow down a child's growth if used for a long time. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor before starting or continuing treatment. It's important to be aware of how Hidex 1.5 mg tablets may interact with other medications you are taking. This can affect how your medications work and may increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Hidex 1.5 mg tablets include drugs that can cause bleeding or bruising, such as antiplatelet drugs and blood thinners, as well as certain cancer drugs, praziquantel, and rilpivirine, among others. If your doctor has prescribed low-dose aspirin for heart attack or stroke prevention, it's important to continue taking it unless instructed otherwise. This medication may also interfere with certain lab tests, so make sure to inform lab personnel and all your doctors that you are taking Hidex 1.5 mg tablets. If someone has taken too much Hidex 1.5 mg, 21 tablets and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center for assistance. It's crucial to act quickly in these situations to ensure the safety and well-being of the individual. It's important not to share this medication with others. If you are using this medication for a long period of time, your doctor may want you to have regular lab and medical tests to monitor your blood mineral levels, blood glucose, complete blood count, bone density, blood pressure, and eye health. Make sure to keep all your medical and lab appointments. Your doctor can provide you with more information on this. Taking this medication for an extended period of time may lead to bone problems, such as osteoporosis. To reduce the risk of bone problems, consider making lifestyle changes like doing weight-bearing exercises, getting enough calcium and vitamin D, quitting smoking, and limiting alcohol intake. It's a good idea to talk to your doctor about lifestyle changes that could benefit you. When is the best time to take this medication? The benefits, daily dosage, and optimal timing can all be discussed with your doctor. If you are taking Hidex 1.5 mg, 21 tablets in a dose pack glucocorticosteroids on a daily basis and you happen to forget a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and continue with your regular schedule. Do not take double the dose to make up for the missed one. If you are taking this medication every other day or are gradually reducing your dose, and you miss a dose, consult your doctor or pharmacist immediately for a new dosing schedule. It's important to store Hidex 1.5 mg, 21 tablets in a dose pack glucocorticosteroids at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always keep medications out of reach of children and pets. When it comes to disposal, do not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. For guidance on how to do this, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.